Hello everyone, I'm hoping you can hear me. Can everybody hear me? Okay. Can anyone hear me? Alright, I'm going to go ahead and get started. When I ask a question, I kind of need you guys to... Okay, good. I need you to type in the chat box. Okay, great. Thank you. Just on the entrance of this class, I had a measurement conversion table website. I don't know if any of you looked it up, but if you need to, it's right here. You can click on that and get the measurement conversions if you need it. Let me just give you a little introduction here. I've been tutoring for the NCLEX quite a lot of people, and a lot of people have been having trouble with the math portion of the pharmacology for the NCLEX. So even if you don't get a lot of questions on the NCLEX about pharmacology, it's extremely important that you know it for your career. Alright, you don't know how many times I've been called as the nursing supervisor to the floor because the nurse tells me we don't have any IV pumps, and I tell the nurse to hang it gravity, and he or she doesn't know how to. So even if you don't get a lot of these questions on your NCLEX, you still need to know it for your career as a nurse, which we will all be nurses eventually, right? So today we're going to learn about the metric system, fluid dosage calculations, tablet dosage, IV rate calculations, IV drop rate calculations, and dosage per weight. Now when I do my calculations, I have an easier way of doing it, or so I think. But if you learn something in school that works better for you, I'm not here to change you. Alright, so if something works for you, then continue to go ahead and do that. Alright? So what we're going to do here is I'm just going to see how good we are at doing our metric conversions. And there's only 10 questions. I know this part is easy. You all may or may have forgotten how to do it. But what I want you to do for the first one is to convert 1,750 milliliters to liters. Okay? Now, how many milliliters is in 1 liter? Do we remember? I'm very happy. There's 1,000 milliliters equals 1 liter. Does everyone agree? Okay, good. So this is the way I do it. Alright, I'm going to write it here for the benefit of those who might be watching the recording. So the way we convert, if we know that 1,000 milliliters is 1 liter, then we know that 1,750 milliliters, this is the way I learned it, it works for me, I don't know who taught me, maybe I taught myself, equals X. So, what I'm looking for is, I'm looking for the X factor. So the way I figure this out is, I times diagonally and divide by the X. Alright, so in other words, I take 1,750 times 1, I times diagonally, and divide by the X. This works for everything. And what do we come up with? We come up with, anybody want to write the answer? Let me get my calculator with you. We take 1,750 times 1. If 1,000 milliliters equaled like 5 grams, then we would go 1,750 times 5 divided by 1,000. But in this particular example, it's only 750. So we go 1,750 times 1, divide by the x, so divide by 1,000, and what's the answer? Somebody write it in the chat box. Good, 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 good. Someone did it. Thank you, B. Carter. Thank you. Very good. So let's continue to do all of these the same way. 2.5 liters. We have to change that to cc's. So what would we do next? Everybody knows that 1 cc equals 1 milliliter, correct? So 2.5 L's equals how many cc's, or how many milliliters? 2,500, right? Because 1 cc is 1 milliliter. So, good. So go ahead. So I just gave you the answer, didn't I? Okay, so that's all we have to do. 2.5 liters to cc's. So that's 2,500 cc's. All right, let's do the next one. Convert 0.7 grams to milligrams. Caring for You is now online. Oh, that's me. All right, very good. Jennifer, that's exactly right. Because 1 gram is 1,000 milligrams. All right, everybody following me? Let's continue. This is the easy part, gang. So let's just keep going here. 250 milligrams to grams. I'll let you go ahead and write that in the chat box. Write the answer. And for the benefit of the broadcast, for the people that aren't here, I'll go ahead and do it this way. If 1,000 mg's equals 1 gram, then 250, you don't want that point, hold on, then 250 milligrams, yes you do, equals, see, even the teacher, well I'm not a teacher, I'm just a student like you guys, equals X grams. Again, I do that same thing. You take 250 times 1 divided by 1,000. So 250 divided by 1,000 equals, you're right, 0.25. All right, very good, Faith. Let's do, very good, everybody who answered, not just Faith. All right, we're all equal here. Faith, but that is a good job. All right, let's convert the 5,000 cc's to liters. Good, B? And we'll just, we just know that because, 1,000 cc's is 1 liter. Convert 5,000 milligrams to, micrograms. You see what I just did? I almost read that question wrong. And that's what we're going to do on the NCLEX if we don't pay attention. So convert 5,000 micrograms to milligrams. Good. All right. And we know that there's 1,000 micrograms in 1 gram. So the answer is in 1 milligram. So the answer is 5 milligrams. Excellent. This part is kind of easy. I just wanted to refresh us all. Let me go back and take this off of, how do I go back on a slide here? Sometimes I want to take this off just a second, gang. Sometimes when you watch the recording, these things get in the way. And I want to do a nice job for you guys. On the next slide. Alright, is this where we left off? Okay, convert 0.25 liters to milliliters, knowing that 1,000 milliliters is 1 liter. I'll let you guys go ahead and do it. Somebody write the correct answer here. Right here. Now listen, for the sake of the NCLEX, on the sheet, some people argue that there's 60 milligrams in a grain. Alright? I mean, some people say 60, some people say 64. For the NCLEX, there is 60 mgs equals 1 grain, right? That's what I want you to know, not 64. People argue about that, alright? I'm going to say 60. So, who's going to give me, very good. B, when the NCLEX asks you stuff like this, straight conversions, I want you to use 60 milligrams for 1 grain, period. That's what I want you to know for the NCLEX. Not 65, not 64, 60. Trust me, I know what I'm talking about. Alright? But thank you for asking. Alright? So, I just told you that answer, didn't I? That there's 60 milligrams is 1 grain. So, alright, very good. Oh, by the way, Faith, when you write the G, and all of you on the NCLEX, please write the GR, okay? Because if you write a G, either you make it a capital G or make it a GR. If you don't, it's going to be wrong on the NCLEX, alright? So, my friends, if we know that there's 60 milligrams in 1 grain, then how many grains is 300 milligrams? Somebody write the right answer. Is it 5? Yeah, you got it. And how did you come up with that answer, everybody? You just took the 300 divided by 60 and you came up with 5, correct? Yes. Good. I'm just repeating myself because this is going to be rebroadcast. Okay, now the last one, pretty simple. Convert 2,100 milliliters to liters. If we know that 1,000 milliliters equals 1 liter, then how many liters is 2,100 milliliters? You can look at it and see almost. That's it. Who's caring for you? You know, who stole my name? Hello? You're confusing me, caring for you. Alright? That's my name. Okay, well, that's good that caring for you got that correct. I would expect no less from myself. Thank you very much. Alright, so everybody's correct with that answer, okay? 2.1 liters. Alright, this is very good. This is just a matter of knowing your conversions. Again, for those of you that came in late, I found a good conversion website. There it is right there. And you can go ahead and, click on that later or whenever you want to and go ahead and get that, the conversions there. There's a lot of other conversions that I'm just not going to go over here. Alright? Alright, so this is an NCLEX alert. Whenever I say NCLEX alert, it means I know something. Alright? So for the NCLEX, make sure you know how to change kilograms to pounds. That's an easy one. Milligrams to grams. This is what shows up the most, okay? Drops to milliliters. Remember that drops, cc's, milliliters are all the same, 1. And then know how to change I'm sorry, drops are not the same as milliliters. So know how to change drops to milliliters, and then know how to change milliliters or cc's to ounces. Okay, these are the important ones that you need to know for the NCLEX. I would know them all, but specifically for the NCLEX, know these. Alright? Little NCLEX alert. Alright, now let's move on to the next area, and that is fluid conversions. Alright, I'm going to get my little piece of paper and my little pencil and do it with you. Alright? Okay, so this formula is used to calculate the amount of medication in a solution for oral, intramuscular, intravenous, or subcutaneous injection to be administered when a given dose, that's what you're supposed to give to the patient, right? A stock dose, that means what you have on hand, and volume. This is the what I want you to write down. We have the ordered dose, what the doctor ordered, over the what we have in stock, the on-hand dose, times the on-hand volume divided by 1, or I'm going to call it the X factor. And this would be this would equal the volume to be given. Now, it doesn't seem like I'm making a whole lot of sense here. Alright? So, for fluid conversions, ordered dose over the on-hand dose times the on-hand volume divided by, we're looking for the volume to be given, what we're supposed to give the patient. Alright? Everybody write that down. I'll just take a second and let you write that down. I'm going to pause the recording. Alright, good job everybody. So for example, a client is ordered 15 milligrams of Stemetel. You have 2 milliliter solution on hand which contains 25 Stemetel. Benedict. Alright. So, what volume of solution should you give? So for this question, we are looking for what are we looking for? We're looking for milliliters, really, right? So the way I set this up is, if you keep the milligrams and the milliliters all in the same order, you could do it any way you want. Watch this. A client has ordered 15 milligrams of Stemetel. You have 2 milliliter solution on hand containing 25 mg's Stemetel, right? So we know that 25 mg's equals 2 mLs. Alright? And we are supposed to give the client 15 mg's. So how many milliliters should we give this client? That's the X factor, right? Now, if we take the 15 times 2, remember my rule? Times diagonally, divide by the X. That's the way I like to do it. Times diagonally, divide by the X. So, whether you do it my way or their way, you're going to come up with the same answer. So let's try it. I'm going to do it my way. 15 times 2 divided by 25, and we come up with 1.2. Alright? Now, you could do it their way and it will work the same way. If you let's do it their way. As long as you keep milligrams and milliliters in, whatever the question's asking, as long as you keep it in the same column, it'll work the same way. 25 times 2 divided by 15 equals. That came out wrong. Alright. 25, wait, I'm looking right at the times 2. Maybe I hit a wrong button. Divided by Right. Right, Faith, you're correct. You know, I might have made a mistake when I wrote this. No, I didn't. 25 divided by 30. Oh, okay, that's exactly what I did. All right, I did it right. Sorry. I'm sorry, I did this right. Exactly, Faith. So this is how we figure this out. Keep the milligrams and milliliters in the same column. Let's try another one, gang. Okay, I hear B. Who is here? We have Ronan, we have B. Carter, we have Faith, we have Jennifer. Oh, we got a lot of people here today. All right, good job. All right, let's hear from somebody we haven't heard from before. All right, a client has ordered 35 milligrams of codeine. Oh, lucky client. Subcutaneous injection. 50 milligrams and 1 milliliter of liquid for the SC injection is available. How many milliliters would you administer? So you want to set it up the same way. We know that 50 mgs, 50 milligrams, equals 1 ml. And I'm supposed to give my client 35 mgs. So I'm looking for the X. So how many, equals. So how many mLs do I give this client? If you times diagonally and divide by the X. Are you guys, I'm sorry I'm asking such a silly question. Are you guys literally figuring this out for yourselves on paper? Or are you just looking at the answer? Okay, thank you very much. I know it seems like it's a dumb question, but it's not. I really want you to take your little, paper and pencil and figure it out, okay? Because we're going to have some that don't have the answer, okay? So this is great. You're all doing wonderful. Thank you very much. Let's go to the next one. All right. A client has ordered 50 milligrams of amoxicillin. And we have 125 milligrams in 5 liters. Set it up the same way. All right. So what do we come up with? If 125 mgs equals 5 ml, then, and we're supposed to give our client 50 mgs, and we're looking for the X. So why do I keep pushing the plus sign? So X ml. How many mLs, gang? Very good, very good. Aqua baby. Very good, Faith. Anyone else? Very good, Jennifer. Anybody else? All right, very good for those of us who typed in the chat box. All right, caring for you, are you listening? I've got my eye on you. All right, let's try one more, and then we will start doing ones that don't have the answer. All right, so a client has ordered 30 milligrams of Lasix, furamide, intravenously. 10 milligrams in 1 milliliter of liquid for IV injection is available. How many milliliters will you administer? We know that 10 mLs, 10 mgs. Okay, good. I'm not even going to finish because I think we're all getting the hang of it, right? Good, 3 milliliters. Very good. Now, I'm going to let you guys. Good, Bernadette. Oh, good to see you here too, Bernadette. All right. Good job, guys. Now I hope I have, okay, so let's figure this one out together. I'm not going to write anything. I want you guys to go ahead, and I'm going to write it on here, on my piece of paper. Well, you go ahead, B. Carter. You figured that out pretty quick by yourself, huh? No, okay. Alrighty. So how did we figure that out? I don't know how you guys are so fast. Yeah. So, how did we figure it out? No, that... Jennifer, you answered the question, and B. Carter agreed with you. Very good. That's exactly how you do it. Okay, this one I will write on the board. You guys go ahead. This is the way I would set it up. I'm supposed to give 50 milligrams intravenously. I know that there's 250 mgs equals 10 mLs. I'm supposed to give 50 mgs. So I'm looking for X mLs. I'm doing this for the benefit of the recording. So I times diagonally and divide by the X. And we come up with 2 milliliters. Very good. You guys are doing wonderful. Do you guys set it up my way, or do you do it a different way? Just out of curiosity. Different. Okay. Well, if you do it different, don't change it now. Alright? If you do it different, don't change it now. Whatever works for you, works for you. Alright? But I like me, and I like my way. But I'm not here to change you. I'm just here to teach you. Alright? So very, very good, gang. Alright, so let's try this one. Alright. Now see, I know how you're coming up with the answer so quickly, because these seem are relatively simple, okay? But as they get more complex, just make sure you know how to do it. Alright? So that's good, everybody. You got the right answer there. Very good, everyone. The answer is 1. Oh, by the way. Oh, let me see. Do I have anything else to tell you? Alright. Let me tell you a little NCLEX alert here. How do I go back? Okay. Let me tell you about the NCLEX. If the NCLEX is asking you how many milliliters would you, how many milliliters per kilogram, or something like that, don't just write 1.5 and leave your fill-in-the-blank answer like that, 1.5, okay? You have to write 1.5 mLs per kg. That's an NCLEX alert. So in other words, make sure whatever the NCLEX is asking you, that you write it out in its entirety. Because if for example, I just wrote 1.5, what's that mean? 1.5 what? And also in how many hours? And, you know, I'll give you an example of that as we go along. But whatever the NCLEX asks you, don't just write 1.5 and leave it at that. Write 1.5 milliliters per kilogram. Or whatever they're asking you, make sure you write the whole thing out. Or the NCLEX will count it as wrong. Alright, and some people got it wrong on their NCLEX because they only wrote the answer and nothing else. I'm going to come to that. I will come to all of that. Faith. Yeah. if the question was asking you that, B. Carter, then that is the way you would write it, not just 1.5. Faith, as far as rounding off the decimal places, usually the NCLEX tells you specifically, right to 1 decimal. It doesn't say right to the nearest hundredth or anything like that. I have some questions I'll go over in this presentation. And Faith, you keep that thought, because if I don't come back to your answer, I want you to I want you to remind me. All right? But I do cover that. All right? And if the answer is, let me tell you something else. Here's another NCLEX alert. Like if your answer is 0.09 mLs, don't write it like that. Write it like this, 0.09 ml. Make sure you're very precise. Alright? Just be as precise as you can on the NCLEX, or the answer will be wrong. So let me see if I have any more examples for you guys. You guys are doing very good. Alright, so it seems to me like I figured that you guys would get the handle on the fluid conversions pretty quickly. So you guys did wonderful on that, and that's great. So let's go with the tablet dosage calculations. This is very simple, right? You have the ordered dose over the on-hand dose, and that is the amount that you would give to your patient. This is pretty simple. This is why you probably won't run into it on the NCLEX. However, ladies and gentlemen, it's important, especially like when you work in a nursing home, and you shouldn't do it, but we do it sometimes, right? Sometimes we run out of medication because we rely on another pharmacy to bring the meds in. So you have to borrow from another patient. I'm not saying don't do this. I'm just using this as an example. This is why it's important to know dosage calculations, specifically for tablets. But I got to tell you right now, you should never borrow medication from another client to give to another client. I'm just saying that it happens, and this is why this comes in handy, especially in long-term care facilities, because we have to rely on pharmacies to bring our stuff in to us. In the hospital, this isn't such an issue. Home health, this is not an issue. Clinical care, this is not an issue. But sometimes it becomes an issue in nursing homes. For the NCLEX, don't borrow medication to give to somebody else. All right? That's just a given. All right, ladies and gentlemen. So the client is ordered 50 milligrams of a medication. When you're doing these questions, and you know the NCLEX is a timed test, don't worry about knowing the med. Okay, that's not what the NCLEX is after. So just quickly glance over that and get to the math. This is pretty simple because it stayed within the same milligram to milligram, right? So we know just by looking at that the client's ordered 50 milligrams. So we take 50 divided by 25, and what do we come up with? Anybody? Thank you, Aqua Baby. Thank you, Jennifer. Thank you, Roman. Thank you, Faith. Thank you, Caring for You. Thank you, B. Carter. All right, good. Yes. 2 tablets. Very good. All right. So a client is ordered 2.5 grams of neomycin. 500 milligram tablets are available. How many tablets will you give? All right. You notice in this question, we have to convert milligrams to grams. So this is what Bernadette. Okay, you have a Q there. All right. So this is what, so we have to convert milligrams to grams first. And we come up with No. One thing at a time. I want you to convert milligram. We have to give 2.5 grams. Right. Okay. Then Well, you know what? I'm going to let you guys arrive to your own conclusions because I don't want to change the way I don't want to I don't want you guys to change the way you know how to do it. So no, Bernadette, you came up with 0.5 milligrams. That would be a big mistake. So we all know how to do this. We have to change the milligrams to grams and then continue with the rest of it. That's the important thing. Miss Carter or Mr. Carter, I don't know what B. Carter is. Do you understand how to come up with the right answer? Okay, great. As long as everybody understands, we will continue. Okay? Like I said, do it your way. I like my way. Oh, okay. Alright, good job. But see, that little mistake, even though you wrote 0.5 grams and you said, what'd you say, mgs? If you make that kind of mistake on the NCLEX, it would be wrong. And that's sad because we know what we're doing. Sometimes we just go too quick, you know? Alright, Miss Thompson has Graves' disease and is prescribed methanol, 7.5 milligrams orally every morning. Her pharmacist fills the prescription with 5 milligram tablets. How many tablets do you tell Mrs. Thompson to take every morning? Now, sometimes the NCLEX has, well, I'll talk about that later. So, what is the answer, ladies and gentlemen? Let me write it here for the benefit of, well, yeah, maybe I won't write it here. I don't think I need to write it here. I think whoever watches this recording is going to understand. Alright, so the answer is 1.5 tablets. And that's pretty simple because there was no changing. You know, it was milligram to milligram. So, try one more. Alright? First, in this question, alright, we have micrograms on order, but the doctor ordered milligrams. So, you have to make sure to change the micrograms to milligrams, which is what I did, and then you continue with the rest. You take the milligrams, so we know that 0.0625 milligrams equals 1 tablet, so 0.125 milligrams equals X tablets, and we come up with what do we come up with? Yes. Good job. I'm going to go ahead and do it with you. Yes, the answer is 2 tablets. I don't know if you can hear me using my calculator on my cell phone, but that's what I'm doing. Again, this is a pretty simple. No, well, like I said, you know, just make sure you pay attention, changing the micrograms to milligrams or whatever the question asks. All right, pretty good, gang, pretty good. All right, let's figure this one out together. I'm giving milligrams, okay. We're looking for tabs. Yep, you got it. I know the way I do it is kind of, a little, more complicated, but when the NCLEX question is more difficult, this way works for me. Alright. But I will tell you, alright, you all got that right because, oh, look at my little zero. Because you wrote 0.5 tabs and not just 0.5, okay? Alright, Bernadette. There. Are you happy? I took my S off. Very good. Alright, very good, Faith. Alright. Let's go to the next one. What do you come up with, gang? Anybody else want to chime in? Do you write tabs or tablets if the question says tablets? It doesn't matter. As long as they know it's a tab. The point I'm making, Benedict, is don't just write 1.5 like Bernadette just did. You see? That would be wrong on the NCLEX. And Bernadette, I know you understand the point I'm making. That's all. You have to write 1.5 tabs. I'm not picking on you, Bernadette. You know I love you. All right. So, yeah, it's a good. Yes, I understand that you understand the concept, and this is what's important. All right. But this is not erased. Okay. Even if you write it, if I ask you to write it in the chat box, I want you to write it correctly. Okay. Because if you get it wrong here, you'll get it wrong on the NCLEX. It's when you're nervous and scared. At least I was. I can only speak for myself. Alright. So, here you go, gang. This is what I want you to write down for IV conversion calculations. Alright. This is the formula. To measure the rate, you have to know the number of drops and the time in minutes. So the formula would work out like this. The milliliters, or the volume, right, times the drop factor, divided by the time, always in minutes, guys. So if it said infusing, I don't know, they would never say this, infusing 200 milliliters in 3 hours, what's 3 hours in minutes? 180, right? Yeah. So make sure 180 minutes. So make sure you always write the time in minutes, not hours. Alright? Let's try. Alright, here's our first example. We have 1,500 milliliters of IV saline is ordered over 12 hours using a drop factor of 15 drops is 1 milliliters. How many drops per minute need to be delivered? Alright, now make sure you take that 12 and times it by 60 because they want it over a 12-hour period. Alright, so make sure we do that first. Where did this come from? Alright guys, so what is the answer we come up with? What is this? Good job. See what I'm saying? You see how that 150 it bled through here? I think. Hold on just a second. No, maybe not. I made a mistake on my PowerPoint presentation. There we go. Alright, great job. So we all know this is the biggest mistake that we do here. We don't make the time, we don't put the time down in minutes. Good job, Bernadette, Jennifer. Alright, again, calculate the drip rate for 100 milliliters of IV fluid to be given over a half hour via a given set which delivers 10 drops. See, this is very simple. I don't know why we need an IV pump. Why are you coming to get me for an IV pump when this is all you have to do? So, so this would be 30 minutes, right? So 100 times the drop rate. Now, the drop rate, how do you know what the drop rate is? Well, the IV comes with IV tubing, correct? And when you get the IV tubing, when you read the package, it'll say drop rate of 15 or drip rate of 20 or drip rate of 10, whatever, 10, 15, 20. It'll say it right on the package. If you ever have to figure out IV drops via gravity. So you just take the amount of medication you're supposed to give, times it by the drip rate factor, which is on the package, and divide it over the total amount of time in minutes. And this is how you come up with the drip rate factor, and this is how you can hang an IV via gravity. Alright? It's right on the package, this drop factor is right on the package, for those of you who didn't know. Alright, let's do this one, gang. Yeah, by the way, everybody's doing a good job today, and I appreciate it, okay? So we have 1 liter of normal saline is charted over, to be charted means, we wrote that in the MedX, over a 9-hour period. The drop factor is 15. This is what I'm talking about. This is what you'll read on the package when you go to get your IV tubing. Calculate the number of drops per minute. Again, it's just the 1 liter, 1 milliliter, right? I had to do a little conversion here because it's asking for drops. So I know that 1 liter is 1,000 milliliters, right? Times 15, and don't forget, do the 9 times 60, and we come up with what Cindy said. Well, I guess Jennifer was first. That doesn't matter who was first. 28 drops. Terrific. If ever in doubt, like I said, the drop factor is always on the IV tubing package. Who knew that? Did you all know that, or is this news to you? Alright, good job, Ronan. Okay, good. So you all knew that. Well, then why am I here? For Christ's sakes. No, I'm just kidding. Alright, let's carry on. Well, if you know this, why the heck am I here, for Christ's sakes? Okay. Oh, thank you. Thank you for reminding me. Okay, so let's figure this one out, young ladies and gentlemen. 1 liter of normal saline is charted over 9 hours. You're supposed to give it over 9 hours. The drop factor is 15. Calculate the number of drops per minute. First thing we want to do is we want to change the liters to milliliters. Right? So, what do we come up with? I'm going to write it on my piece of paper here. Oh yeah, Benedict? Alright, you figured it out that quick. For the, let me go ahead and write this for the sake of whoever's going to watch the recording. Alright? I'm only going to do this one. I would write it out like this: 1,000 ml times 15. That's my drop rate. Oops. I'm just doing this for whoever's going to watch the recording, so just bear with me here. Divided by, what's 9 times 60? And this is how we would do it. Thank you very much, B. Carter. 540 minutes. So whoever's watching will know how to set it up. Okay? And we all set it up that way. And that is the correct answer. Well, excuse me. Let me ask you, what's the correct answer? 1,000 ml times 15 divided by 540 minutes, and we come up with 1,000 times, even I have to do my math, which is good because I don't know what 9 times 60 is off the top of my head. So we come up with Ronan, how did you come? Well, could you please explain? Yeah, you want to round it off in this particular case, guys, because there's no way physically possible you can give 27.7777777 drops. But Ronan, how did you come up with your answer? Is this where you round off to the nearest whole number? Benedict, for the NCLEX, yes, you would, because it's physically impossible. Let me answer Benedict first. Benedict, it's physically impossible to give 27.7777777 drops per minute. Okay, so you have to use logic and round it off. All right. Let me see your. Let me see what you did here. 28 drops. Oh, you came up with the right answer. Why am I picking on you, Ronan? You came up with the right answer. Hello? I'm not paying attention. Sorry for picking on you. All right. So, Benedict, does that answer your question? All right, ladies and gentlemen, shall we try to figure this one out? You are required to administer 500 milliliters of normal saline. That's ridiculous. These questions are ridiculous. Who gives normal saline? Let's see. People are asking me questions here. Over 3.5 hours, and the drop factor is 10. Yes, good job, Benedict. You're asking for the NCLEX sake. That's good, because whoever watches this recording is going to ask the same question. So thank you for asking. All right. So what did we come up with this answer? I'll just write it here again. We have 500 times, I'm very slow, aren't I, gang? 10. Jeez, I'm glad I didn't have a lot of math on my NCLEX. 60 times, okay, 3.5. That's how we set it up. Yeah? And we come up with 20. Oh, thank you. Everybody's finished. What a good group. I can manage you guys any day of the week. All right. Round it up to 23,809. Yeah, Would you round down if it was? Yes. No, yeah. Well, if it was 23.222, it would just be 23. Good question. Good question, Cindy. So, if it was 23.8, you would round it up to 24. If it's 23.2 milliliters, you round it down to 23. It's because it's virtually impossible to do the 0.22222. All right? Excellent question. Thank you, Cindy. You're welcome, sweetheart. All right, let's do this one. 1 1/2 liters of IV fluids is prescribed over 8 hours. I'm not going to write anything on the board here. Whoever's viewing this recording later should know by now. And if not, they can rewatch it. The drip factor is 15. How many drops per minute are required to start the flow off at a correct rate? We first have to do... Okay, that's a good question. Go ahead and figure this question out, gang, and I'll answer the questions in the chat box. I read in a book, and I think I have it here as an NCLEX tip as well. 5.5 and above, you round to the higher number, and anything lower than 5, you round to the lower number. Okay, that's good, B. Carter. Anyone else have the correct answer? Good, Cindy. Good, Faith. Good, Ronan. Bernadette, you're just copying everybody else. No, I'm just kidding. Good job, Jennifer. Okay, so you guys know how to do this. Pretty good. Pretty good job. And just pay attention, like, you know, these have been relatively easy. Well, just pay attention to when you have to change. I gotta stop saying easy, you know what I'm saying? Because when we're taking the NCLEX, it ain't easy. You know, because we have things we're worrying about here. Just make sure you pay attention to your conversion factors when you do these IV things. All right, let me erase this in case it comes to the next slide. All right. Anybody have any questions? So far, so good? On the NCLEX, divide symbol is not on the calculator. It's got to be on the calculator. It might not look the divide. Okay, it might look like this. Let me write it here. It might not look like the divide, but do you have anything like that? That's a divide symbol as well. Jennifer? Okay. Yeah. So this is a divide symbol for the NCLEX. I did not know this, so thank you for bringing that up. So for those of you taking the NCLEX, the divide symbol as we know it may not be there. So the forward slash, like you see on the website, is the divide symbol. Like caring for you done that / Annalise, okay? That might be the divide symbol. All right, you're welcome, sweetheart. Anybody else have any questions? I didn't know they didn't have the divide symbol. It's been so long since '97. I don't know. Okay, so for the dosage weight calculations, we never use pounds in medicine. I don't know why. We always use kilograms. So the first thing you need to do is to convert the patient's weight from pounds to kilograms. In other words, divide the weight by 2.2. If you guys get confused, just remember that kilograms is always less than pounds. So 90, I mean, I am pretty thin if I weigh 40 kilograms. That's thin. Or 50 kilograms. That sounds better than 100 pounds, doesn't it? You know, 110, thank you, B. Carter. So now a lot of people get that confused, okay? But always remember, if you get confused, kilograms are always a smaller number than the pounds that are listed on the NCLEX question. It's never a higher number. It's always a smaller number, okay? So, for example, we have Salumedrol, 1.5 milligrams per kilogram, is ordered for a child weighing 74.8 pounds. So, right off the bat, we know that we have to change the pounds to kilograms, so the kilograms is going to be less than 74.8 pounds. So if it's more, then you just got it backwards, all right? So by the way, Jennifer, so the way you figure this out is you take the 74.8 pounds divided by, there's my /. That might be what you're seeing on the NCLEX. 2.2 pounds equals 34 kilograms, right? And then we can go ahead and figure out our calculation. How many milliliters would the nurse administer? Well, we have to give 1.5 milligrams times 34 kilograms is 51 milligrams. This is how many milligrams we have to give to the client. Figure that out first, right? On hand, we have 125 milligrams divided, 225 milligrams per every 2 milliliters, right? So we know we have to give 51 milligrams to our client. And on hand, we have 125 equals 2 milliliters. So, this didn't come out right when I uploaded it. So, if we multiply, okay, you guys know how to do this. Multiply diagonally and divide by the x. I don't know why this didn't come up right. I'll put it here, 125. For the sake of my viewing audience. 51 times 2 divided by 125, you'll come out with, like Cindy said, 0.16, so you make it 0.82 milliliters. Alright. Now, had that been a 0.85, what would we do, Cindy? Because sometimes the NCLEX asks, write your answer using 1 decimal. So, let me write this down. If the NCLEX would have asked, right? No, honey. I said using 1, which they do. Use 1 decimal place. I know for a fact they do this. Then your answer would have been, then your answer would have been 0.8. Now, does everybody understand what I'm trying to say? I know for a fact that the NCLEX will say, write your answer. Okay, let me repeat myself. All right, let me take this off here. All right, if the NCLEX would have said, well, the NCLEX will tell you, Faith. The NCLEX will tell you. Sometimes the NCLEX... What is this red one? You have a new message. I guess people are trying to ask me questions. But the problem is I don't know how to answer. Alright, listen. If the NCLEX would have said, write your answer using 1 decimal place, see, if you look on the board, the answer is 0.82. I know for a fact the NCLEX says, write your answer using 1 decimal place. If the NCLEX says that, then your answer would have been 0.8, period. B, look, I'm using what's on the board as an example. You are correct. If the answer was 0.852, 0.8623 or something like that, then it would be 0.9. And I have a question we're going to go over that's exactly like the one you're asking. Alright, how many decimal places should it be? First of all, don't worry about decimal places unless the NCLEX specifically asks. Write your answer using 1 decimal. Alright, it'll say specifically, trust me when I tell you, it'll say specifically, write your answer using 2 decimals. Write your answer using 1 decimal. It will specifically ask you to do that. So what I think we're not understanding is, when do you round up and when does it stay the same? Now, or when do you round, go lower? Now, if it's 0.85b, then it absolutely would be 0.9. However, you don't do that unless the NCLEX is asking you specifically, round your answer to the first decimal. The NCLEX will specifically ask you that. And unless they ask you that, don't do it. Okay? Does that answer everybody's question? Am I making myself clear? Okay, great. All right, because sometimes, teachers don't make themselves clear. And if they don't ask, don't round. Well, it depends on the question. Like, for example, B, there's no way I can give an IV at 27.777777 drops per minute. So in that case, I would round it, because I can't easily do that unless I have an IV pump, but you can't assume you have an IV pump, and you don't have an IV pump when you're taking the NCLEX. And somebody is raising their hand. All right, this is new to me about this raising hand business, so I don't mind. Let's see. Yeah, go ahead. Layla? Did you have a question you wanted to ask me? I'll let you go ahead and ask while I go to the next question. Alright, gang. Now, go ahead and ask your question, Layla. I'm terrible with Layla. Layla, I think. Go ahead and raise your hand and ask me your question. Now, this is what I want you to know for the NCLEX, okay? NCLEX alert. Pay attention to the question. If it says round to the nearest tenth, hundredth, or thousandth, then do it. Alright? So, for example, the nearest tenth would be 0.846. Okay? The nearest hundredth would be 0.84. See the 4? That's the hundredth. Okay? The thousandth would be 0.846. Alright? But I'm just telling you this for informational purposes only. Really, for the NCLEX, you're really not going to see this too much, but this is a problem when I tutor the math for the NCLEX privately. So this is why I went ahead and wrote it here. Alright? You're not really going to see this on the NCLEX. What you're more likely to see on the NCLEX, it will say, mark your answer using 1 decimal place. This is what I was trying to explain to you, okay? Everybody who, asked me earlier. So, if the answer was 0.846, now it becomes 0.8. If the next number was 5 or higher, the answer would have been 0.9 milliliters or drops or whatever the question was asking. If it was lower than 5, then it would, like it is here, 0.846, then write the answer as 0.8. But I know for sure the NCLEX will say mark your answer using 1 decimal place. It won't really, at least I didn't run into it. Oh, by the way, I want to tell you something while I'm thinking about it. If you have, apparently if you have adult attention deficit disorder, you're allowed to call somebody for help. They will give you a cell phone at the NCLEX testing place, and then you will also get an extra 3 hours added onto your NCLEX. So for those of you who didn't know that, that's a fact. If you have adult attention deficit disorder, apparently they will accommodate you and allow you to call someone for help and give you an extra 3 hours on your NCLEX. Now, knowing that, you guys can't run out today and go get your, get your doctor to say you have an adult attention deficit disorder and then go take your NCLEX, okay? Because people that have true attention deficit disorder had to have help all through college, and so Pearson VUE is going to want proof that you have this. And one of the proofs that they have that they make you give them is the fact that you needed help all through college, or that you went through a special psychiatrist for your adult attention deficit disorder. So don't think you can go get a doctor's note from the from your regular doctor and then go to the Pearson VUE. It's not going to work. They want a lot of documentation that you also had troubles in college as well. So, but I never knew that a person with adult attention deficit disorder documented, not just by a doctor's note, what was allowed to have help by using a cell phone at the test center. So if any of you know that, tell your friends and family or whoever, tell your teachers even. I don't think your teachers know, and most people don't think of attention deficit disorder as a disability, but it is, and Pearson VUE will accommodate that. Okay? So now you know. So when I tell you things that I know will be on the NCLEX, trust me when I tell you it will be that way. Alright? Alright, here's another NCLEX alert. When adding up fluid shift intake, don't forget the IV. Alright? So often people, it's a relatively simple question, but people forget. If you're receiving 125 milliliters an hour, and the question was to figure out the milliliters, the fluid, the INO, for an 8-hour shift, you have to take the 125 and times it by 8. All right. And then add that up along with your other fluids. All right. What's going on? What's the matter? What's Leila doing here? Am I leaving you out, Layla? If you're trying to chat, the chat box is under the current chatting. below the front box. I had to minimize my screen to find it. Oh, really? Okay. Layla, would you like the microphone? Do you have a question? I don't want to leave you out. Let me stop the recording just for a minute, gang. All right. So as I was saying earlier, when you're figuring out your fluid intake for the shift, even though it's an easy question, don't forget to take your IV per hour and times that first. Okay, don't take 125 for the whole shift. Somebody actually made that mistake and got that question wrong. All right. So, all right. Now this is a difficult question here. So let's figure this one out together. All right. The nurse is caring for a client who had a prescription. I'll let you guys read it. I'm going to write a message in the chat box here. And I'm going to call this all right. So pay attention to this question. All right. All right. So somebody tell me, let's walk through this. What do we have to do first? What is the first step we take? Just answer that question first. Please don't figure this question out. Let's walk through it together. Convert what? B, that's a brilliant, good. Yes, we convert the pounds. Right. So let's do that. All right. So let's do that first. And what do we come up with? No need to, what am I trying to say? No need to go lower or higher. Keep all your answers the same at this point, okay? All right, now what is the second thing we have to do? All right, so we converted the weight. All right, the nurse has 100 milliliters per available. How many? Okay, so we're supposed to give 2.5 milligrams per kilogram. Okay, good, Cindy. That's what I want you to do second. Excellent job. All right. All right. So we have that. What is the answer? 72 times 2.5 is what? Good. All right. Good. Nope. Not 181 because it's 0.8. So if you're going to do anything, change it to 182. All right. So, all right. So we know we have to give this young gentleman, or old gentleman, I don't know, this client, 182 milligrams a day, right? Well, again, Benedict, again, it's impossible for me to give 181.8. All right. So at this point, you can round it. All right. So we have to give him 181 milligrams. All right. Daily. We have on hand 100 milligrams per milliliter. All right. So how many milliliters do we give this young man or this client daily? We give him 182 milligrams. Well, right. Cindy, yeah, divide it in half, and what do you come up with? Cindy, is that what you did? 1.82 daily, correct. Wait. Jennifer, you have the right idea. 1.82 daily, okay? That's how much we have to give this guy, or this client. But we're not done yet, because we have to, it says in 2 divided doses. So if we take the 1.82 and divide it in half, what do we come up with? Okay, Cindy, you're right, 0.91. Now, Faith, you're right, because we have to pay attention to the 2 divided doses. Now, are we done there? Okay, Jennifer. Jennifer, you came the closest to writing your question correctly, but because you wrote milligrams per dose. But look at the question. It says write your answer using 1 decimal place. So the answer would be, it says how many milliliters should the nurse administer each dose? So the answer is 0.9, 1 decimal place. Oops, what am I doing with it? 0.9, 1 decimal place per dose. Alright, this is the complete answer. This is what you write in your fill in the blank. Ronan, okay, don't write 0.9. Alright, because people can mistake that for a 9. Alright, always, seriously, that could be a big med error. I know because it's happened before. Never write 0.9 because people in their rush, they don't see the little dot. Okay, always write it 0.9. And always write out what the NCLEX is asking. How many milliliters should the nurse administer each dose? So you want to write 0.9 milliliters per dose. This is the correct answer. Not 0.9 mLs. Alright, not 0.92, because it said 1 decimal place. You see how tricky these NCLEX questions are? You have to pay attention to each and every aspect of the question. Alright? So this would be, it is very tricky. We got a couple things going on here. First, it said in 2 PO in 2 divided doses, so we figured out we had to give 1.82 milligrams a day, but a lot of people forget to divide. So in 2 divided doses, okay? And then the other tricky question, the other tricky thing was, it says, this is what I'm talking about. Usually the NCLEX doesn't say the nearest hundredth or whatever, but it did say write your answer using 1 decimal place. Okay, well, I'm not saying this was actually on the NCLEX. I'm just saying this is the way the NCLEX is. Alright? Does everyone understand that? I want to know if you understand that, and I also want to know if you have any questions. Okay, terrific. Alright, Layla, I hope you're okay. I hope you can hear me. I hope you don't have any questions. Because if you're being awful quiet, and I don't want to leave you out. So I hope you're alright. Let me take this away, because sometimes it bleeds through to the next slide. Alright, now let's try again, gang. You're doing a good job, okay? Alright. Alright. Figure this one out. The nurse is caring for a 10-year-old client who has a prescription for Ancef, 7 milligrams PO twice daily. Now, I'm telling you right now, pay attention to the twice daily, right? Alright, we already know that we have to change the kilograms to... Do we have to do that? Yeah, he's 66 pounds. So, I'll just write the steps. That's one thing, alright? Okay. That's the second thing. And the third thing to pay attention to is if you did not use a whole number, what would you have come up? What would you have come up with? If you did not use a whole number, what would you have come up with? Good. So, and people do write that. They do write 4.2 milliliters per day. But it says record your answer using a whole number. Getting back to what Bernadette, Cindy, that's correct. But in this particular case, it said record your answer using a whole number. If it doesn't tell you to do that, do not do it. Okay? Only do what the NCLEX asks you to do. Alright? So for the purpose of the recording, just the first, you need to change your pounds to kilograms. You need to pay attention to the twice daily. People forget that. And then the other thing they make a mistake is they don't record using the whole number. Good job, Benedict. Benedict. What am I going to do with you? I mean, how original. Okay, sweetheart. Let's carry on. Next question, okay? Let me take this away. Because sometimes it bleeds through to the next slide. Alright. Are we ready? Okay, this is our last question, and then this will be the end. I'll call this a well, let me not write that. Alright, guys. This is pretty... What's the answer here? Now, this is what I was talking about earlier. Well, let me let you figure it out. First of all, to figure this out, it wants to know how many milliliters for the shift, right? So let me ask you a question right now. How many milliliters are in an ounce? Anyone? Everyone? Terrific. So you guys already know that you have to take the 8 ounces and you have to times that by 30. You have to take the 4 ounces, times it by 30, blah, blah, blah. Alright? Good. And the most important thing, this question wasn't so tricky, but some people get it wrong because they take that 125 milliliters per hour and they make it just 125 for the whole 8-hour shift. And the NCLEX is asking you how many milliliters for the entire shift. So what, Cindy and B. Carter, you're not finished yet. What should your answer be? Yeah, write the whole thing out. When in doubt, write the whole thing out. Faith, how did you... Faith, darling, how did you come up with 3,900? I would like Faith to do it again. Faith, take the 6 ounces. No, honey. No, no, no. All right, Faith, here we go. All right. You take the 6 ounces. Faith, pay attention. This is just for Faith. Everybody hold still just for 1 second while I help Faith, okay? I sound like I'm talking to my little son, who's 7. All right, so there's 30 cc's in an ounce, Faith. So we have to take 6 ounces, 6 ounces times 30, all right? Add that up, okay? Then we have to take the 8 ounces times 30. Add that up, all right? The 4 ounces times 30. Add that up. You know, just put it like this right now, right, Faith? And then 12 ounces times 30 equals, right? Did I miss anything? I think I got everything. 6 ounces, 8 ounces, 4 ounces, 12 ounces. Okay. Okay. And then we have to take the 125 milliliters, milliliters, and we have to times that by 8 because it's an 8-hour shift. And then, Faith, you take all of these things. No, it's only asking for an 8-hour shift, right? So you take all these things that we added up, and we have to, don't forget the IV, it's 125 an hour for 8 hours, that's why the 8's there. And we simply add all these things up, and we should have came out with 1,900 milliliters per 8-hour shift. Okay? Jennifer, the question specifically asked for 8 hours. Now, nurses work 8 hours, nurses work 12 hours. Nurses work, you know, those are, so I would play it safe and write, good job, Faith, there you go, I would play it safe and write 1,900 milliliters per 8-hour shift. Alright? For the NCLEX. Trust me when I tell you, this will be correct. Alright? This brings us to the end of this session. Does anybody have any questions? Any questions before I close? And while you guys are typing and asking me questions, I will tell you that when I do free sessions, I can only have 25 people view this recording or be in this class. So so I'm having an EKG presentation, and I went ahead and charged $1 for it, so that 9,999 people can view it. I mean, what's $1? Nothing. And that $1's not even going to me. I think it's going to go to WizIQ. But anyway, You just pay the dollar via PayPal like you would any other thing, you know. Sorry, did I say PayPal or was I Q? It'll take you to PayPal, and just go ahead and pay the dollar, and then it'll let you in. Well, it's cheap because I'm not making. I would have it free if I could, but I can't. When I have a free class, I can only have 25 people max. Is this the only math on the NCLEX? B, what we did, this question, okay, I'll give you my personal experience with the NCLEX. Something like this question will be on the NCLEX. Something like this question was on the NCLEX, and something like this question was on the NCLEX. The other stuff could very well be on the NCLEX, but I didn't have experience when I helped the young lady with the with any other dosage calculations. Now that doesn't mean that you will not. So it's important. I think it's important to know your tablets. All right, let me go back here and take a look. I'll answer your question in just 1 second here. For the NCLEX, I think it's extremely important to know this and mostly this NCLEX alert and mostly this NCLEX alert. Aqua Baby. What kind of a question is that? Really? I think the LPNs will be giving out the same meds that the RN's giving out, yes? So yeah, to answer your question, it is the same, okay? So know all that. Know the same thing that there's really not that much difference between the RN and the LPN exam, except for maybe delegation. The LPN is more like what can the CNA do, and the RN is more like, you know, what can the LPN do? Of course, the LPN's not going to delegate to the RN. That's really the only difference, and this is why I help everybody, not just RNs. And not just LPNs, okay? When is the schedule for the EKG? All right, I'll post a link here for you. I really would like you guys to. I'm trying to put it up on YouTube. I'm trying to put it up on YouTube. Of course, that'll be free there. But here is the link for the EKG. That's going to be a Saturday as well. 2 p.m. Eastern time, my time, Eastern time. Is there another place where we can get this practice? Yeah, okay, one question at a time. Let's do EKG. EKG class is here. Let's talk about this first, okay? All right, now. I know you have to pay a measly $1. I think WizIQ takes it. Alright? Now, you'll go to that page. It'll say Join Class. There's a little green button that says Join Class. That'll take you... It'll have you either sign in via your Facebook page, or if you created a WizIQ account. You have to sign in. And then click on the and then it will take you to PayPal. You pay your you pay your $1, okay? Then it'll bring you back to the page, and then it will say launch class, and then you can come to the EKG class just like you did this class. And if you want to know what time, it's Saturday. Everybody should got an email. The 15th. The 15th, 2012 at 2 p. EST. If you did not get an email, then go ahead to my website, and it's just easier for me because my website's so easy. answer right all the time. And just click on the Contact Us page, and I'll send you an email. But you should be able to join this class simply. All right. If I could make it free, it would have been free. But I only have a limited number of people that can join when it's free. Now let's see. So, okay, B, no problem. Now let's see. Who else had a question? Jennifer, I think you had a question, and oh, you wanted more practice, more math practice. Okay, on my website, you guys, there's free resources, and there is, click on the free resources page, and you should see, more free resources for the math. Okay, just scroll down and find the free resources for math. And Ronan says meant doing other classes. Okay, hold on there, Jennifer. Just 1 second, everybody. Ronan, I'm not understanding your when will you be doing other classes? Okay. Ronan, I just posted when I'll be doing the EKG class. This is the only class I'll be doing for a while. Alright, because it takes a long time to put these things together. So, no, I did the math. You know, here's my thing, guys. Let me turn the recording off just a second. Okay, hold on just a second. Let me turn the recording off. Alright, so this officially brings us to the end of the class here. So the recording is going to go off. I'm going to post a link one more time before we go. This is for the measurements and the conversion table. And this is for the EKG class. Alright, keep visiting my website because there's always new information. And I'll see you guys later. I don't know how to end the class. Alright, you're welcome, guys. Thank you very much for coming. God bless you and good luck on your NCLEX. And keep in touch. And like I said, if you want tutoring, it's on the front page. Only $25 an hour, so. And if anybody has any questions, you can call me at 856-392-5675. If you want to have any questions about the NCLEX or anything, okay? Alright, God bless you. Have a good day, and I'll see you guys around. Thank you. Bye-bye.